So in this study, known as a Delphi analysis, we enrolled 26 participants, including specialties such as emergency medicine, critical care, laboratory medicine, infectious disease, as well as pharmacy. And we presented patient scenarios to these providers and asked them to make a determination, is this patient septic or not? We then looked at overall agreement with clinical impression to get a better sense of what level of agreement do we have among different providers on who's septic and who's not. So as an example, this is a patient that was shown to the group. So this is a 72-year-old female who is a nursing home resident. She has a past medical history that's significant for dementia, hypertension, and dyslipidemia. And at baseline, she is normally mobile. She can transfer herself from her nursing home bed or chair to her wheelchair. And she is usually described as being bright, sunny, and communicative. On the morning of presentation, healthcare workers at the skilled nursing facility noted she had altered acute mental status, and she was difficult to arise. Based on these symptoms, she was sent to the emergency room via ambulance. And on presentation to the ED, she was noted to have a temp of 97.8, a heart rate of 84, and a respiratory rate of 16. Her blood pressure was slightly elevated at 98/62, and her O2 was 95% on room air. In the ED, she's noted to be somnolent and responds only to physical stimulus. Some key findings from laboratory results: she had a white blood cell count of 98. Her lactate was measured to be 2.8. Her creatinine was 1.9, which was noted to be above a baseline of 0.8. And on UA, she was noted to have had nitrites, bacteria in her urine, and white blood cells present in her urine. So getting this patient description, our diverse group of providers were then asked to determine what is the risk of sepsis in this patient. And you'll see, based on this patient scenario, we had a great deal of disagreement in whether this patient was septic or not. And we saw this to be true over and over again based on different variations of patient presentations. In this particular case, we had physicians that were voting with as low of a sepsis probability of 2% to as high of a probability of 1% or of 100%. And our median was right at 50%. So the chance of this group agreeing of whether this patient was septic or not was on par with flipping a coin.